Hello, dear friends. How are you doing today? I hope you are doing well. Welcome to another question on dermatology. A 54-year-old woman with a history of type 1 diabetes mellitus presents with unsightly toenails affecting the lateral 3 nails of the left foot. Upon examination, the nails are brown and break easily. Nail scrapings demonstrate trichophyton rubrum infection. What is the treatment of choice? A. Oral terbinafine for 12 weeks. B. Oral itraconazole for 4 weeks. C. Topical itraconazole for 2 weeks. D. Topical amorolfine for 6 weeks. And E. Oral itraconazole for 1 week. Okay, here we have a 54-year-old diabetic patients coming with unsightly toenails. The most common presentation of their patients with onychomycosis is unsightly toenails. Upon examination, we see that the nails are brown and break easily, which is one of the another presentation of patients with onychomycosis. Nail scrapings demonstrate trichophyton rubrum infection. Trichophyton rubrum is one of the most common cause of onychomycosis. What is the treatment of choice? The treatment of choice for onychomycosis is usually oral terbinafine for 12 weeks. Okay. And the answer is oral terbinafine for 12 weeks. Here we are going to explain it. Explanation. Dermatophyte nail infection or onychomycosis. Oral terbinafine for 12 weeks is the treatment of choice. As we said, fungal nail infections. Onychomycosis is a fungal infection of the nails. This may be caused by dermatophytes, mainly trichophyton rubrum accounts for 90% of cases. As we said, is the most common type of onychomycosis. And in the test of this patient, also trichophyton rubrum is found. Okay, trichophyton rubrum accounts for 90% of cases with onychomycosis. Yeast such as candida and non-dermatophyte molds we can see also in onychomycosis. Risk factors for fungal nail infections include diabetes mellitus and increasing age. Both are due to the decreased the immunity level. We can say it's in diabetic patients, we can say in old people. Okay, diabetes mellitus and increasing age are their most common risk factors. Features of onychomycosis or fungal nail infection. Unsightly nails are a common reason for presentation. As we said, thickened, rough, opaque nails are the most common finding for their onychomycosis. Fungal toenails classification. Here we can see different types of fungal toenail infection with different presentation. Okay, here we can see distal lateral subungual onychomycosis. Here we can see superficial white onychomycosis. Here we can see proximal subungual onychomycosis. And this photo is showing endonyx onychomycosis, and this photo is showing totally dystrophic onychomycosis. The toenail is totally destroyed. Okay, where onychomycosis infects the where onychomycosis infects the underneath of the nail plate, the infection produces a thick nodule or hypha that contains clusters of branching filaments called dermatophytoma. Distal lateral subungual onychomycosis is the most common type of onychomycosis, and it is characterized by the built-up soft yellow keratin between the nail plate and the nail bed. Okay. As we can see here, distal lateral subungual onychomycosis is, as we said, is the most common presentation of onychomycosis or fungal nail infection. Okay, white superficial onychomycosis is characterized by distinct white islands on the nail surface. As we can see here also, this one is showing white superficial onychomycosis. We can see the islands, the white islands of the infected nail. Okay, endonyx onychomycosis is indicated by white milky patches without subungual hyperkeratosis. Here we can see endonyx onychomycosis, as we can see here also endonyx onychomycosis. Proximal subungual onychomycosis is characterized by white discoloration and parunesia with discharge. Okay, in proximal subungual onychomycosis we can see discharge. Also we can see proximal subungual onychomycosis in this picture. Okay, and totally dystrophic onychomycosis is the most advanced type that invades the nail plate, nail bed, and nail matrix, causing severe dystrophy. As we can see here, the nail is totally destroyed. As we said here, we can see total dystrophic onychomycosis, and the toenail is totally destroyed. Okay, differential diagnosis of onychomycosis: psoriasis, repeated trauma, lichen planus, yellow nail syndrome. We can see unsightly fingernails or toenails in these situations too. Okay, investigations: nail clippings, scraping of the affected nail. The false negative rate for cultures is around 30%, and it's high. So repeat samples may need to be sent if the clinical suspicion is high. If the patient is coming with unsightly toenail and we rule out the psoriasis, repeated trauma, lichen planus, yellow nail syndrome, or we are highly suspicious for the onychomycosis, then we can repeat the samples. Management of onychomycosis: treatment is successful in around 50 to 80% of people, and diagnosis should be confirmed by microbiology before starting treatment. Dermatophyte infection: in dermatophyte infection, oral terbinafine is currently recommended first line with oral itraconazole as an alternative. 6 weeks to 3 months therapy is needed for fingernail infections, whilst toenails should be treated for 3 to 6 months. If the patient is coming with fingernails infections, we must treat the patient 6 weeks to 3 months with oral terbinafine or oral itraconazole. But if the patient has the infection over toenails, we must continue the treatment for 3 to 6 months with oral itraconazole or oral terbinafine or oral itraconazole. Okay, candida infection. Mild disease should be treated with topical antifungals. If the patient has infection, toenail infection or fingernail infection with candida, and it's mild, then we can treat it with topical antifungals like amorolfine, while some severe infections should be treated with oral itraconazole for a period of 12 weeks. If the candida infection is also severe, then we must treat the patient for oral itraconazole for a period of 12 weeks. Here we can see some pictures which are showing the nails before and after receiving treatment. Here we can see the infected nail, and here we can see that nail after 6 months of the therapy. Here we can see infected, another infected nail, and we can see that nail after 6 months of therapy. Here we can see also an infected toenail, and that toenail after 6 months of receiving therapy. And this photo is also showing the total treatment after receiving the therapy. Okay, here was a short explanation about about fungal fingernail and toenail infection or onychomycosis, its treatment and management. Thank you for your attention.